Right. Hi, everybody. Thank you so much for this opportunity to talk to you today. So my name is Sarah Russell. I am a clinical exercise specialist, clinical Pilates teacher, and cancer rehabilitation specialist. I specialise in working with people who've had any kind of abdominal surgery. Myself back in 2010, not for womb cancer, but for a bowel condition, and that resulted in 5 surgeries, and I now live with a permanent colostomy bag, which I've had since 2010. So, but what that did, I'd been a fitness instructor for 20 years at that point, and what that did, it raised this huge awareness to me of this big gap in care around the abdomen, whether you've had gynae surgery, bowel surgery, stoma surgery, whatever that might be. We have rehab after if we have a knee replacement or a hip replacement or cardiac rehab, but we don't really ever talk about the abdomen, and we don't really ever talk about the pelvic floor. So I am deeply passionate about restoring function of the core and the pelvic floor, because when you've had abdominal surgery, you're terrified to do anything, you're terrified to move again, and you're lucky if a physio or somebody in your hospital might point you in the direction of a leaflet, but do you know if you're doing the exercises correctly? So that's my absolute passion, and I work all over the world with nurses and with patients, and I run my own clinic specifically for bowel cancer patients, actually. But anyway, I'll stop waffling and get to the nuts and bolts of what I want to talk about. So I want to go through. I haven't got any slides, and I want to talk about the practicalities of pelvic floor, the core, how it all integrates, and give you some practical exercises to do. Now, I can't really see anybody, so I'm hoping that you might all join along at home. And then if you want to watch this on repeat, you can come back and practice again. So I want to talk about the pelvic floor and why it's so important and how it integrates with the core and the diaphragm. So I want you to imagine that inside you've got a can. So this is your deepest layer of abdominal muscle. So you've got your diaphragm at the top and you've got your pelvic floor at the bottom. And then we have this kind of wraparound muscle called the transverse abdominis. Now, when we have surgery to the abdominal wall and or to the pelvic floor, it creates a dysfunction. And actually, when we go through menopause, we also create a dysfunction. So whether you've had surgery or not, and even if you've not had abdominal surgery, you've had surgery vaginally, the hormone changes and everything that goes on in that region can cause a level of dysfunction. And you just kind of feel like it doesn't feel like it belongs to you anymore. So I want you to imagine we've got this can, diaphragm at the top, pelvic floor at the bottom, wraparound muscle. Now this all works together as one integrated unit. It is not something that's just kind of, we can't just squeeze the pelvic floor. So I want you to sort of join along with me now. We're going to do something called diaphragmatic breathing. And I want you to try and get an understanding of the difference between, or what happens with the pelvic floor and the diaphragm. So when we breathe, the diaphragm moves up and down. And the pelvic floor is almost like a second diaphragm, and it moves with the diaphragm. So bring our hands around our rib cage. I want you to feel the ribs at the front and bring your thumbs to the back if you can. You don't want to tense up in your shoulders, but just kind of bring your hands around your rib cage. We're going to take a breath in through the nose, and we're going to breathe out through the mouth. So we breathe into the ribs, and I want you to feel the ribs expand wide, and then exhale through the mouth and feel the ribs come down. Now keep doing that, and as you keep doing that, I'm going to explain a little bit more about what's happening. So as the ribs are expanding, the diaphragm's moving down, the pelvic floor moves down with it. As we breathe out, the ribs come back down, the diaphragm recoils back up, and the pelvic floor lifts. So breathing out in itself is actually a coordinated exercise for the pelvic floor. So this time as we do the breath, I want you to imagine that top and bottom of the lift, so your diaphragm and your pelvic floor. And as you breathe in, I want to see if you can feel maybe a little bit of downward pressure through the pelvic floor. Don't force it. I want you to see and notice if it's there. And then when you breathe out, the ribs come down, the diaphragm lifts back up, and the pelvic floor comes back up with it. Just practice that a couple more times. If you're not feeling anything, don't worry too much. This comes with practice. So I want you to go away and practice this feeling of the ribs opening like an umbrella, the ribs closing back down like an umbrella, and then the bottom of your lift coming back up inside. And that happens without you having to really think about it. It's just that coordinated movement that occurs. So practice some diaphragmatic breathing, either in standing, seated, or lying on your back. And then we're going to start to bring in the pelvic floor a little bit more consciously. You're probably very familiar with pelvic floor exercises, that general squeeze, and we want to kind of get that squeeze. It's not as simple as that. We need to get a coordination between the muscles of the core, the diaphragm, and the pelvic floor. Everything needs to work together. So if you're sitting in a chair, I just want you to really relax and sit up nice and tall. So this time we're going to bring a bit more awareness to the pelvic floor. So my cue this time on the exhale is going to be thinking around closing up your vaginal area, closing up your anal area, and trying to draw up inside. So we're going to breathe in like we did before. You might feel a little bit of downward pressure. We're going to breathe out through the mouth. And I want you to feel like you're closing up your vaginal area, your anal area, and drawing your pelvic floor up inside, like not just a squeeze, but a drawing up. And then relax and let it go completely. Now, one of the big mistakes is that we don't relax the pelvic floor enough. So we end up with this kind of like semi-contracted pelvic floor all the time, which actually makes it weak. So what we want to do is get the contraction and the relaxation. So let's really focus on that low level of pelvic floor. Sit up nice and tall. Take a nice breath in through the nose. You're going to feel the ribs widen a little bit of pressure down into the pelvic floor. And then exhale, ribs come down and draw the pelvic floor up inside. Now we're going to hold it, and we're going to hold for a count of 5, 4, 3, 2, and 1. And then let the pelvic floor relax completely. So those are called slow squeezes, but we're integrating them with the breath, and that's really, really important. It's important that when people do their pelvic floor exercise, they will often hold their breath. So we don't want to do that. We want to integrate the breath with that contraction and then the relaxation phase. Okay, so we've got slow squeezes. Now we want to build up to, and you might not be able to do it initially, but build up to 10 seconds and 10-second hold, and you repeat it 10 times. So we hold for 10 seconds, we rest for 10 seconds, and we repeat it 10 times. So that would be the optimal level you get to. But we also want to work the pelvic floor with little fast squeezes as well. So this time it's more like a little pulse. So we squeeze, relax, squeeze, relax, squeeze, relax. Don't worry too much about the breath with this one, but I just want you to not hold your breath. So we're going to try 5. So are we ready? So we're going to squeeze, relax, squeeze, relax. Really important that you're not tensing your bottom. So if you're bouncing up and down on the chair, you're using your glute muscles and you're not using your internal pelvic floor muscles. Squeeze, relax, squeeze, relax. And then just let everything relax and let it go. So that's about 5 or 6 reps. So let's try that again. So just have a little wiggle, sit nice and tall. You might even want to close your eyes as you work through this. So again, we're going to squeeze, relax, like a quick flick, relax, squeeze, relax, squeeze, relax. 2 more, relax, squeeze, relax, and let it go. Some people find the long holds harder, some people find the quick squeezes harder. It completely depends on you. So that's your starting point. So we start with the diaphragmatic breathing to kind of set up this coordination of the diaphragm, the deep core, and the pelvic floor. We then integrate those squeezes. So we don't just want to squeeze randomly. We need to create a little set. We need to build on that progressively, and we need to integrate the breathing into that. And that's really, really important before you go and do any kind of running or anything particularly high impact type of exercise. There's a really good app called the NHS Squeezy app, which is very low cost. I think it's about £2 or £3. You can download it, and you can set up then the number of reps and the number of squeezes that you want to do. Another really, really good thing to try and do is some clinical Pilates. So I teach that online. I have a studio called the Ostomy Studio, which is aimed at people who have bowel surgery or colostomy bags. However, some kind of clinical physio-led Pilates class would be really, really good, because what we don't just want to do is squeeze the pelvic floor. That's not enough. We need to integrate it into the body and then make it functional so it's working for you in all sorts of different movements. So I think that's probably it. I've probably run over a little bit, I'm not sure. So I'm going to leave that there. I just want to kind of give you just a little taster of some things to practice. So practice your diaphragm breathing, that rib breathing, and then practice those pelvic floor squeezes, and remember to relax between each repetition.